Heroin epidemic continues in Wisconsin, but now there's a new concern about a far more deadly drug possibly making its way into Wisconsin for the very first time.
Yeah, I talked with Attorney General Brad Schimmel about this dangerous new drug and the challenges facing law enforcement.
This epidemic, this is a public health crisis.
As a former county prosecutor, Brad Schimmel is well aware of the explosion of heroin and opiate overdose deaths. But there's a new concern for Wisconsin's Attorney General. It's called carfentanil.
We do have something that has had a preliminary test that it may be carfentanil in our state.
When did this happen?
This has been in the course of the last month that we've discovered this.
If confirmed, it would add to a crisis already gripping the state. Carfentanil is a synthetic opioid that is more deadly than fentanyl and far more lethal than heroin.
Here's something really frightening about it. Drug dogs don't detect fentanyl or carfentanil. You can get it shipped to you in the mail, and that's what people are often doing now.
Schimmel says the opioid addiction problem usually starts at home with prescription painkillers.
We know that 70% of the time when people start abusing prescription opiates, they didn't get them from a doctor or a drug dealer, or at least not a traditional drug dealer. They got them from a family member or a friend.
To help battle that problem, Wisconsin has a statewide program that allows people to turn in unused prescribed medications. Schimmel says Wisconsin now ranks second in the country in collecting prescribed meds, nearly 59,000 pounds this year.
10 semi-truckloads in the last 2 years have been safely incinerated.
And where's most of that coming from? Is it the big cities? Is it the suburbs?
Everywhere. It's every community.
Now, the state has multiple drop-off sites for those unused prescription drugs, and you can find them in our online version of this story.